mesothelioma is it's a very unusual disease, and most people, we were just talking beforehand, most people get told that there's nothing they can do. Most surgeons will say there's nothing they can do. There are a few fanatical surgeons that want to do everything and don't want to do a big operation for their patients and do them some good, but in reality, surgeons have to be smart rather than aggressive about taking care of mesothelioma.
In that many people don't understand radiation therapy very well, and it's nice to be able to talk to a multidisciplinary community to bounce idea, educate about the role of radiation therapy in different diseases.
So implications for all this diffuse tumor on surgical technique, it has to do with looking inside the chest. So this is the right chest, this is the left chest, and the only real difference is there's a lot of veins on this side and arteries on this side in the aorta. But the lung is removed and you're looking on the inside to see what you have to deal with. And so there's chest wall with lots of ribs and intercostal muscle. There's a pericardium in here. There's some soft tissue up here where the thymus is, and there's a diaphragm. And these are all the normal structures, and the lining is on all these things. So taking it off with any kind of normal margin of tissue would be impossible.
What I will do is just give you an insight of what is new in targeted therapy. So we will leave the operable mesothelioma. I will speak of advanced or inoperable mesothelioma. The other issue is that my review will hence not be comprehensive. I will only stick to those issues that are, I think, of interest because they are new.
What I will discuss today is chemotherapy, and some of it I have tough speakers to follow. Some of it is going to be repetitive, but nevertheless, we'll proceed. I have no disclosures. This is a summary of the intraoperative chemotherapy trials. Again, a dose of chemotherapy was given in the recovery room. However, in most of these trials, the patient also received adjuvant systemic therapy, even though those are the drugs that we no longer use mitomycin or epirubicin. However, the median overall survival was not significantly different than the survival that we have seen with neoadjuvant chemotherapy.
Unrelieved pain is one of the most feared symptoms in patients with cancer, and studies have shown that about 75% of patients with cancer, unfortunately, are experiencing pain that's difficult to control. As you know, and as you've heard from previous speakers, there have been a lot of recent oncological advances for treatment options. However, sometimes these also present with challenges that are difficult for us as physicians, especially with pain that's difficult to manage.
Until very recently, there wasn't very much interest for immunotherapy in mesothelioma. And certainly a lot of research has been done, also by us, but also by others. And the end of last year, there was 2 important papers came out who also have revived the interest for immunotherapy very much.
So what's important is for us to try to understand what the molecular mechanisms behind the molecular mechanisms behind the genetic and epigenetic changes that occur in the development of mesothelioma, and then how we could use this information to either find better treatments or be able to detect the disease earlier or at an earlier stage. And although a lot of work has been done in this area, progress is still lagging behind other more common cancers.
Idea that this issue of public health and the use of asbestos is not one of the distant past, but one of the current present. So what should we do? We should continue to work toward banning the use of asbestos throughout the world, as some 55 countries have already done. However, the United States, Canada, North America don't fall into this category.
We've been talking a lot today about basic science research, so we can do that in our facility, and we have Dr. Cameron. That's great that we can look to see what's working, what's not, and try to develop some standard of care, because we still don't have a standard of care here, how to take care of these patients, and people are doing different things that range from no treatment to something totally radical. So we just still need to define that, and I think that having this population and evaluating it can potentially help that.
Now, PHLBI is a non-profit, which means that any money earned or donated to must be used in the pursuit of the organization's mission. You've met Dr. Wong and Dr. Yankulescu, myself and a part-time assistant. Our offices are at 10780 Santa Monica Boulevard. We're governed by a board of directors and bylaws, and we have a scientific advisory board, of which Dr. Cameron is one of our scientific advisors.
Don't be afraid to put your support, or be encouraged to put your support behind the Meso Center and behind their efforts. As small as they are, they're effective. And I really believe we're one phone call away, one person away from really getting this thing going.
No one really wants to step up to the plate and say, I may have been responsible. I want to invest in a cure for this disaster, because that may come along with some liability. But it's clear if you look back scientifically about how social movements start. It takes collective activism. It takes civil society, the private sector, and the government to come together, working collectively, harmoniously, and organically to make this end.